South Carolina's economy is growing, bringing new businesses and opportunities. The need for electricity is growing too. At Duke Energy, we're meeting the challenge, providing even more electricity that's reliable, that stays affordable. To do this, we're investing in our communities with a diverse, balanced mix of energy sources and making targeted upgrades to the grid so that South Carolina can thrive in a smarter energy future. Paid for by Duke Energy shareholders.
The most exciting part of a vacation stay at a home rental? Easy. It's being greeted upon arrival with a rusted lockbox affixed to the underside of a stranger's condo. Yeah, you simply twist knobs, click gears, jiggle it, and then rip it off its moorings, and voila! Your prize is a key to a questionable home rental and maybe tetanus. When you just want to get your vacation started by actually getting into your room, it matters where you stay. At Hilton, we deliver your key right to your phone on the Hilton Honors app. Hilton for the stay.
This is Book TV's Afterwards podcast. This week, law professor John Fabian Witt examines the relationship between law, epidemics, and public health guidelines. He's interviewed by Georgetown University law professor and director of the Institute for National and Global Health Law, Lawrence Gostin.
Hi, I've got with me a wonderful author who's written a fantastic book, John Fabian Witt. John, you're a distinguished law scholar and distinguished historian, and you've given us a book for the ages exactly at the right time we need it in the midst of a pandemic. And so you've said that that your goal is to do a citizen's guide. What did you mean by that?
Well, great question. I wanted to write a book that would be a first draft of the history of the law of epidemics for the era of COVID and beyond, but that would speak to an interested reader, not just the specialists in the field. There are lots of specialists in the field, and I thought my value added might be to translate from specialists in the field to readers who are just fascinated by the blizzard of legal issues that have arisen just in the last 6 months that weren't really on most people's agenda until now.
No, and of course it also, we never thought about past epidemics, but we're certainly thinking about them now, particularly, what can we learn from them and, what do we know when it's going to be over? But I want to begin, John, if I can, really at the end of your book, and then I'm going to pivot back at the end of our interview to ask you more about this question. But you write, America has two histories, one ugly, the other far more appealing. In the months and years ahead, Americans will hold the power between them. Let's hope they make the right choice. Now, I'm going to be asking you more about what that right choice is at the end of our interview. But for now, I just wanted to know, what is the ugly part of America and what's the appealing part?
That's a great question. That's really what came out for me in these historical materials, was these two histories. Let's start with the ugly part, just get right to it. The ugly part is a really dreadful history of discrimination around disease against racial minorities, against sexual minorities, against the poor. People without political clout have found themselves on the losing side of legal responses to epidemics, basically since European arrival in North America. It goes way back. And it's amazing the way in which disease has been a through line in that long history of discrimination that we really need to grapple with, and that COVID has brought out again. When you think about the racially disparate effects of COVID, the way it's affected poor communities of color, much worse than middle class and white communities. It really brings that history back. So that's one central piece of the ugly side of the history. I could have written a book that was just about the ugly side. I really found so much material there. I also thought, though, that there was a contested politics of disease in our legal history, and that there were junctures where disease had revealed certain inequities that hadn't been as salient or hadn't been as clear before disease rendered really evident just how poverty shaped various communities. And so throughout the 19th century into the 20th, we see various forms of progressive reform designed to lift up the people who are the poorest in the community, in part because their health matters for everybody else's health. And so that vision of solidarity holds in it a different kind of politics and, to my mind, a more hopeful legal approach. So both of those histories are in our past, and I think they're in our present, and I'm sure both of them will be in our future. I just don't know what the ratio will be.
Yeah, I mean, that's really interesting. Of course, you're right. I mean, people of color, Black Americans, American Indians, Latinx have really suffered, 4 times greater hospitalizations, deaths, cases from COVID than the non-Hispanic white population. So you're absolutely right there. And, in terms of the bigotry, we've got a president now that, is calling this, the Wuhan virus, the China virus. How does that play into the bigotry?
That's interesting. There have certainly been moments for demagoguery around disease, going back, scapegoating, long history of scapegoating. I think, for example, of the fear around bubonic plague at turn of the 20th century San Francisco, which produced a targeted set of inoculation and quarantine orders, aimed exclusively at the Chinese population. In a way,
I know that.
It's kind of an important case in our history, and it reveals some of the ways in which particular populations could be scapegoated in the process to advance various communities' interests and politicians' interests.
Just out of my curiosity, you're talking about the Juho case from San Francisco, where they quarantined an area of San Francisco, but left out, but only applied it to the Chinese American populations. The court struck it down, saying it's an evil eye and an unequal hand. That was a local decision. Have we seen a president of the United States feed into the bigotry in terms of a pandemic and the kind of intersection between scapegoating countries, peoples on the one hand and public health on the other?
I don't think we have. It's always dangerous for a historian to say that there isn't a good precedent, that there are always resonances with the past. This particular feature, I don't know that we've seen as much. I mean, the Wilson administration, President Woodrow Wilson, during and immediately after World War II, faced a pandemic, the influenza pandemic of 1918, 1919. And Wilson is really thought to largely have stayed silent on the pandemic. In part, it helped him mobilize troops and send troops abroad without talking about it. There was lots of action at the state and local level. And our history is largely a history of state and local officials struggling with infectious disease, while the feds stay out or have a peripheral role at the border since World War II with guidance and things like that. So this is the first pandemic, I think, where a president has gotten centrally involved. The first huge pandemic in history. Yeah,
I was on a panel the other day, and they were talking about another great epidemic, maybe our last one, the AIDS epidemic, which is, pandemic and still going on. And they, and this was somebody who was in the Bush White House and started PEPFAR, which is the big emergency program for AIDS, which is a great legacy for the United States and great U.S. leadership in global health. But he pointed out something that I thought was really interesting, which is, that, Reagan during AIDS, like Wilson in the way that you were saying, never mentioned AIDS, but he didn't get in the way. He didn't criticize science. He didn't, castigate his or undermine his public health agencies. And so for this White House person under the Bush administration, he thought it was, really, unusual for a president to be so, taking a stand against the big public health agencies, FDA, CDC, as we know with Tony Fauci right at the moment. Is that your sense? Is that?
Well, part of it is that the presidency has changed in American history so dramatically in the 20th century. and in particular in the New Deal and post-World War II periods. So that the rise of the modern presidency comes in some sense after the first great age of epidemics and pandemics in American history. There's a wonderful quip in your field, really, in the field of public health, that the 19th century was followed by the 20th century, was followed by the 19th century again. So the return of infectious diseases, the reemergence of some, the emergence of new ones, has put 21st century presidents in a 19th century setting, and that's a new phenomenon for us. And
no, it really is odd. What a great point, John, because we're really fighting at the moment until we get the vaccine and some really good treatments. We're really fighting with 19th century tools. We're quarantining, we're contact tracing. We don't have a vaccine. We're locking down cities. And I'm going to get to lockdowns a bit later on, but let me start now. But to drill down a little bit into your wonderful book, you talk about the police powers. You start with the police powers, and police powers sounds really quite ominous. It conjures up a police state, but you point out that that's not the case. Is that right? Tell us about that.
Right. So the police power, I think, is really a misunderstood piece of American history. And there have been some historians at work for a couple decades now trying to tell the real story of the police power. The police power doesn't have anything to do with anyone in uniform. It's not about the state troopers or the cops on the beat. It's essentially the basic fundamental power of the collectivity to look out for its members. I mean, that's what we're talking about, is the authority of local and state governments to make sure that their communities stay healthy and stay well, and to look out for them and help them to prosper. That's the police power. It is the constituent power of collective self-government. And it's at the heart of political communities like ours. Oftentimes we've lost track of that, I think, over the course of history. And one of the wonderful things about doing the research for this book was just encountering in the 18th, going back into the 17th century, but in the 18th and early 19th century, a plethora of examples of instances where state governments organized themselves around looking after the health and welfare of people in epidemics. That was central to self-government at the founding of this country.
And it's interesting about the police powers because you start the book with an epigraph from Cicero saying health is the highest law of the land. And, that does suggest to me what you've said, which is that government has no greater power or duty than to protect the health and security of our citizens. And a theory of democracy is that, there are a lot of things we can do for ourselves, but quintessentially, we can't stop epidemic diseases by ourselves. We need a collective to do that. So I think, police powers is important. You make another important point about the police powers in the United States specifically, John, because you point out who holds that power primarily. Tell us a little bit about that, because it's going to be really important for Americans and the public to understand, who's in charge in this pandemic.
Well, Larry, you're right. One of the really peculiar features of American constitutional structure is that the federal government is usually said not to have the police power. The federal government has enumerated powers specifically listed in the U.S. Constitution, and the police power lies with the states and subordinate to them, local governments. And so it's one of the reasons we've seen governors and mayors emerge over the last 6-7 months as central actors in our pandemic. Is this the police power goes to the states? It's a distinctive feature, makes us different from lots of other countries around the world.
Sure does. And, of course, the federal government does have certain limited powers in terms of, quarantine at the border, things you talk about in the book, and potentially even to prevent a disease from going from state to state, but they haven't really used that very much.
It's also, just to jump in there.
Yeah, please.
one could easily imagine a federal government that was much more ambitious than that, and that tried to use its commerce power or its spending power to have a much more contrary to the history approach. We don't have anything like that now, and the neither presidential candidate right now is proposing to do any such thing.
No, of course, but Biden is suggesting a national mask mandate, and I'm going to get to that in just a minute. The interesting thing here is, there's a lot of discussion. Is American federalism partly to blame for what seems to be a fairly catastrophic failure by the United States per capita? We're certainly in the top 5 worst performing countries, and arguably in the top 2. And some people have said, well, look, this is because we've got 50 jurisdictions plus hundreds of cities and counties and sheriffs, and we can't function that way without a national leadership. Do you think federalism has hurt us, or has it been the great Brandeis laboratory of the states where we innovate?
Yeah, I think it's hard to say either way. The historian's view is to say it has powerfully shaped our response. The reason I say it's hard to say either way is the federal government has a variety of powers that it could deploy in very useful ways to help shape the United States' response to the pandemic. It could help solve collective action problems when states are peculiarly poorly situated to respond. So, for example, in the acquisition of PPE, one could imagine the federal government taking a role there so as to resolve competition among the states. That's a really useful example. But in a moment of epidemic or pandemic, there will be regional variation. And so having the capacity to have regionally differing rules is really quite useful. And whether you do that from the top or whether you do it from the bottom, I think probably there are pluses and minuses. And I don't know that I'm the best to make that judgment.
Yeah, the PPE is a great example because, as all of our listeners will remember, we've had states competing for price to buy PPE and ventilators and things like that, and that seemed to be so counterproductive. There are federalist societies around the world that have performed very well, like Germany, and some not so well. So it's I guess it is an open question, but. One of the things that's on the top of a lot of people's mind, and in fact, a former FDA commissioner recently did an op-ed where he called for a national mask mandate. And Biden himself has called for a national mask mandate. I wrote an article in the Journal of the American Medical Association saying, well, hold on, does the president have the power to do that? I mean, so and this leads to a couple of things. Is it the president, or must it be Congress? And secondly, even if it was Congress, do the commerce powers justify it? How could we get more uniformity nationally, particularly in masks and other, protective, preventive mechanisms that we're trying to promote?
Right. Well, but my sense is the president's biggest capacity is the bully pulpit. Yeah. Right. That is the power of the president to set an example, to model, to encourage, to exhort. That's where the federal executive branch, I think, may have its largest power. And there will be fine questions, nice questions, complicated questions. That's just lawyer talk. Just complicated, hard questions about whether the Congress has the authority to impose a mask mandate across the board. And my sense already is that some of the proposals are narrow, targeted mask mandates in federal facilities, mask mandates in interstate transportation. Places where the federal government has obvious authority according to traditional constitutional standards. Why the federal? I mean, I'd step back and say I think there are political constraints that will stop a national mask mandate before we get to legal constraints. I just don't know that Congress wants to be in the business of enacting a national mask mandate when probably that kind of rule can be done pretty effectively at the state level, is my own inclination. The federal government should set a good standard. and then that kind of thing could be left to states.
Yeah, well, maybe if we had clear and consistent messaging from the top about masks, the bully pulpit, as you say, might do just the trick. We're going to have to see, because a lot of people have thought that if everybody masked up, we could save tens of thousands of deaths. Whether that will happen in the United States, I don't know. And that kind of brings me to my next set of questions. You talk about various traditions in the United States and in our history, from the colonial period, right on through to all of the epidemics, and now to COVID-19. And you talk about this kind of tug, really more than a tug, a real fight between individual rights, civil liberties on the one hand, and the common good and population-based health on the other. And most of us think, as you say in the book, and then go on to refute it historically, most of us think that America is a place of rugged individualism, and it does seem that way now when we look at how we've responded to COVID-19, as opposed to, say, Asian countries or even European ones. But is that true? I mean, are we rugged individualists in our history, and are we now?
The viruses bring out that, in fact, rugged individualism is a kind of suicide pact. And our history, the founders of this country understood that really quite powerfully. It's in the 1790s. 1 in 10 residents of Philadelphia died of yellow fever. I mean, we now have 0.1% of the U.S. population has died of COVID in the last 6 months. 10% of Philadelphia died. I grew up in the neighborhood that was the federal government's evacuation place from Philadelphia in the 1790s during yellow fever. So I grew up with this in some sense. But rugged individualism is a terrible way to deal with infectious disease, and collective authority through democratic processes to help communities flourish is really the alternative. One way to think about this is that we've had a myth in this country that freedom comes from the government staying out. In moments of epidemics, freedom comes from figuring out a way to work collectively through the government to give us all the resources, vaccines and the like, that'll help us flourish. And that tradition runs deep through American history, deeper than the rugged individualism idea.
Yeah, and of course you know me, and that speaks to my heart. I totally agree with you. But there are others that say that civil liberties matter more. I actually wrote an autobiography in a Journal of Law and Society entitled "From a Civil Libertarian to a Sanitarian," because I was actually the head of the British ACLU and then on the board of the ACLU here, and now here I am, a pure, common gooder and collectivist, as you seem to be. But there is a tension here, isn't there? I mean, how do we get the balance right? Because you don't want public health to be a license for trotting on liberties. Where can we draw that line, and how do we know it's the right line?
It's a great question, and I think there's a hopeful thread in American court cases over the course of the 19th and into the 20th century on just this point. What we have a tradition of courts reviewing public health decisions and insisting that they be rational, that they be non-discriminatory, that they proceed with the democratic authority of the legislature. And that tradition has been a way in which judges have overseen really vital public health measures to prevent epidemics and minimize the damage from epidemics, without ever letting the supposed individual rights of the rugged individual to interfere with or block really vital public health measures that support the freedom of all of us. And that tradition is one that really comes out strongly. But one of my favorite cases for this is a case that you know well. It's the Jacobson case out of Massachusetts.
I was hoping you'd mention that case.
1905. And so this is the case that still today, stands for the proposition that states can mandate vaccination in adult members of the American population, whether those adults want to be vaccinated or not, whether those adults have a medical reason for getting out of the vaccine or not. And that case, which is decided, it's written by really great justice on the U.S. Supreme Court, John Marshall Harlan, in 1905, and that case announces that our freedom depends on our capacity to live together and to protect ourselves from disease. But it doesn't stop there. And you know this as well as anyone. It doesn't stop there. It observes that there might be some situations where it would be arbitrary or capricious or especially cruel to administer a vaccine. And I understand that as the Supreme Court and Justice Harlan saying, we're going to stay involved. We're going to oversee and police and manage vaccine programs in the future, not to block them, not to stop them, not to insert our preferences over the preferences of the city of Cambridge or the state of Massachusetts, but instead to make sure that rationality and equality are respected. I think that's a really glorious and important tradition.
Yeah, but do you think it's going to hold up? I mean, is Jacobson going to hold up with a 6-3 conservative majority on the Supreme Court with a Justice Barrett on the court? There's a lot of conservative scholars that are saying, well, Jacobson deference to public health, doesn't fly, particularly in relation to, religious liberties and even economic liberties. I'm going to drill down into the religion and economic, but just a general sense now, whether or not Jacobson is going to be robust, in this next decade.
Right. Well, I think predicting how 9 people will behave is a fool's errand. Yeah. But I'll say it this way. Jacobson is a charter of civilization. I mean, it's a little bit like authorizing a military draft. States that want to survive, I mean, states in the international sense, the United States, nation states. If nation states want to survive, they have to be able to do the things that are required to respond to emergencies. And sometimes military drafts are required, and a well-done military draft might have a narrow, conscientious objector provision, but judges aren't in a really good position to manage that question. And similarly, a nation state that wants to survive a pandemic has to be able to take the steps to mandate vaccines. So I think Jacobson's indispensable to our survival, and I hope it'll survive.
I love your term, charter of civilization. I think and I agree entirely that, as we're going to survive as a civilized, safe, healthy nation, we need to, as a collective, protect each other and the common good. And no better example of that is in epidemic response. So you talk in the book, you have actually separate chapters on each of these about the so-called quarantinist and sanitarist states. What did you mean by that? And if that's a true kind of two ends of a bookend, where are we now?
So it's great question. The public health, the history of public health is the way the literature tells the story is by talking about 2 different traditions. One is, let's start with the quarantinist tradition. It's a tradition of harsh quarantines that manage and police bodies, draw lines and boundaries, restrict sick people behind fences and the like. And that's the quarantinist tradition, which runs through all sorts of government responses to epidemics in the past. The alternative tradition, the sanitationist or sanitarian tradition, is a tradition that imagines that disease comes not from infection among people, but from environments, and that managing the environments, improving the environments, is a better way than quarantinism to respond to disease. I use in the book quarantinism and sanitationism or sanitarianism as somewhat synonymous with authoritarian approaches on the one hand and liberal approaches on the other. And that dichotomy runs through our history, through European history, and all over the world.
Yeah, I mean, and what do you think about lockdowns and in looking at those traditions? I mean, we certainly saw, particularly in the great influenza pandemic, cities closing off. But I wonder if, could you have ever imagined that, New York, Los Angeles, Beijing, Delhi, London would be absolutely locked down in relation to a pandemic, even with all of your experience with, yellow fever and smallpox? Does that surprise you? Or did you think, oh, well, that was going to happen?
Well, it took me by surprise, and I think many members of my generation. I'm born in the year in which the United States stops inoculating people for smallpox. I'm born in February 1972, so I've got a smallpox inoculation swirl, but people born at the end of the year do not. And so my lifetime had, until now, it's been easy to understand my lifetime as the period in which we had defeated disease. Of course, those who were paying attention, like you, knew that same period is the period of the slow reemergence and new emergence of various infectious diseases. So many of my peers hadn't imagined that we'd be in this sort of a lockdown situation. I guess historically, maybe we could have anticipated it. That is, the United States has a mixed tradition. We're partly sanitarianist and we're partly quarantinist. We have both those threads running through our history. Relatively rarely, never anything like the travel lockdowns that we've had. Of course, we never had the kind of transportation technologies we have now during a moment of pandemic. So all these things have converged in this moment.
South Carolina's economy is growing, bringing new businesses and opportunities. The need for electricity is growing too. At Duke Energy, we're meeting the challenge, providing even more electricity that's reliable, that stays affordable. To do this, we're investing in our communities with a diverse, balanced mix of energy sources and making targeted upgrades to the grid so that South Carolina can thrive in a smarter energy future. Paid for by Duke Energy shareholders.
Yeah, well, I want to now drill down a little bit even more to specific public health powers, within those two traditions. And just get your take on them. We've talked a little bit about, quarantine, and we started with, the unusual case of quarantine, this mass quarantine, closing down big cities, countries, just really, something that, boggles the imagination. But quarantines themselves, just simply of individuals or groups that have been exposed to disease, go back centuries, don't they?
Yeah, for sure. That is, quarantine is actually one of the classic powers of government to control the bodies of people under its jurisdiction in order to maintain the health. Now, of course, that power comes with huge risks because the power is awesome and so delivers the real risk of abuse, even as it's indispensable to our self-government. And, Larry, that might be our fundamental dilemma here, is that power is indispensable and also incredibly risky, right? It's just true of human collective living together is incredibly risky and is indispensable. It's just what we have. There's really no other choices. So what we've got to do is find a way to muddle through. I'd like to think that history has some really good examples of muddling through, and also some terrible ones. So
yeah, no, that's great. I mean, I love the way you explain that. It's basically, quarantine is part of us as a civilization. We can abuse it, but we need it, and we need to live together. And in order to live together, we need to keep each other safe. So quarantine goes back centuries. What about contact tracing? It's interesting, as somebody that's worked in public and global health now for many, many decades, that all of a sudden everybody's a public health expert, and things that we've been talking about for decades, like testing, tracing, these things, social separation, these things have been, now they're in the common lexicon, like I'd never thought I would see. So contact tracing does go back in the American history with sexually transmitted diseases, AIDS, tuberculosis. So, what did we learn from previous uses of contact tracing, and what do you think are the benefits and the risks now?
Well, I think we're at a really interesting and important juncture in the history of contact tracing and public health around infectious diseases more generally. For the last half century, there's been an idea coming to the fore, which is that civil liberties and public health might actually run together. That actually maybe the best way to promote public health isn't to lock things down. It's to ensure that people who get sick know that they'll be cared for. It allows them to come forward, identify themselves. We can learn about diseases. Maybe civil liberties is good for public health. But new technologies are coming online. And we're at a juncture where it could be that idea of the synthesis of civil liberties and public health could turn out to have been contingent, a kind of accident of a particular mode of particular time in our history when we couldn't track people. But now let's think about the cell phone. Let's think about the tracing, the contact tracing and surveillance technologies we have available to us now. And that means contact tracing is new now. It's not just a matter of sending out people by foot to figure out who was near whom. Now we can do it through phones. And that means we have the power to not only collect this information, but then store it. And I think we're seeing Americans have really complicated reactions to the scary potential of contact tracing in its new form. In some ways it's very old fashioned, but its new form has all sorts of scary features.
Yeah, I was really glad you moved there. I was about to get into the electronic tracing ideas. But before I even do that, it's really interesting the fact that, we're actually not doing a lot of electronic tracing. We're still doing 19th century, 20th century, shoe and leather, walking around, and we're not doing that particularly well. But in the United States, we haven't adopted these kind of smartphone location apps the way China, Taiwan, South Korea, and even in Europe have used, because we're worried about privacy. We want to make it voluntary, but if it's voluntary, it won't work. And we also have genetic tracing, so we can kind of trace, based upon genetic features of particular viral strains. So why is America not embraced more the technology of tracing, and should we?
Well, we've had, I think it's in part about forgetting about the value of the police power. That is to say, what old-fashioned contact tracing is about person power, right? It's about building up the capacity of the state to have the human beings to make the phone calls, to do the work, to have the shoe leather costs of going around and finding and tracking and tracing. And that requires people. It requires state governments that can bring on board that kind of state capacity. I'm lucky enough to teach at Yale University, where we brought students back this fall, and we've got an extraordinarily effective so far. Can I knock on wood on C-SPAN? Can I do this? Knock on wood. So far, successful. It's here. It's October 26th. So let's hope this keeps working. But we have a huge number of contact tracers who've been able to connect people to students when students have tested positive, and it's been extraordinarily successful for us in the last 2 months. We don't have that kind of capacity in our public institutions. And so one of the things this pandemic is presenting the United States with is the value of state capacity, so that our public institutions can do what some of our richest private institutions have started doing on behalf of their members.
Yeah, so we can, it certainly tells us we need to have a stronger public health infrastructure. But it still leaves open, of course, the idea of how we embrace technology. Very, very quickly, because we're running out of time, and I've got so many more questions I want to ask you. Speaking of technology, you talked about, how the world has changed since flu and yellow fever, with all the globalization and the travel and things like that. But one of the core differences is now we have social media. We've got all of these conspiracy theories around COVID-19, vaccines, a whole range of things. a lot of disinformation from the top of government that fans conspiracy theories. What do we make of that? How do we deal, with science and good health education and health literacy when we've got all of this, frankly, untruths just swirling all around us, so that part of America has a completely different set of facts than another part of America?
Right. Well, there's some historical precedents for this, and so one of the things one can find looking at cholera era newspapers in New York City is a conviction by the Democrats representing Irish immigrants who are my ancestors, really, in New York, persuaded that public health measures are anti-immigrant and stirring up Democratic voters against Republican-sponsored public health measures in New York City and Whig public health measures in New York City. So we see that going way back. And of course, it's also true that public health authorities have sometimes lied to people. That's also part of our history. One of the ugly threads we started this program with was the racism in public health and the infamous Tuskegee experiments running for 4 decades, from the 1930s into the 1970s, in which African-American men were experimented on to see what the course of syphilis would be, asymptomatic syphilis in their body. So America.
And just to remind viewers, in that experiment, they had effective treatments and they didn't treat the African Americans.
They just opted not to do these. Just dreadful. And so Americans know about that history, and that makes it all the harder to combat conspiracy theories and lies in the present. And the only substitute, I think, for rampant conspiracy theories is trust in government and trust in scientific expertise. And we're at a really low moment for that. It'll be fascinating to see how the vaccine rollout happens. Hopefully, in the coming months, and trust is going to be indispensable. So we've got to figure out how to reestablish that trust. It's trust. The Center for Disease Control famously did work to establish trust for decades. I mean, it became a world-respected institution based in Atlanta, and the trust it developed was really quite important and vital. And hopefully, we can get back to something like that.
I hope so. It just seems so, the trust in CDC and our other public health agencies has plummeted. And so I really do hope we can get back to that. I think that's, if I were going to say one thing that separates the countries that have done well and badly with COVID, is adherence to science and trust in science and public health. The United States has not done well there. We've talked about, the police power side, and we've talked a little bit about the other, the trade-offs with privacy and liberty. But let me just get you to talk a little bit about specific liberties that I think, will be very important with COVID, have been very important with COVID, and also with the new Supreme Court. First, let's start with religious liberty. The idea, that, for vaccines, should religions be exempted or have an exemption? Should churches be exempt or from having to abide by the rules of congregation, and lack of public gatherings? These are things that have already come to the Supreme Court twice, and very narrow 5-4 decisions, with Roberts siding with public health. That might not happen in the future. How do we think about, the trade-off between public health and religious freedoms?
Well, it's a question that's surging to the fore in our politics right now. We've got not just those 2 Supreme Court cases, but also circuit court cases and the federal courts of appeals. So that this is really central, and it's not just central in COVID litigation. It's become central in the regulatory state more generally. I mean, it's not a COVID problem, it's a regulatory state problem. How to think about religious freedoms. And I suppose the puzzle here is, on the one hand, religious discrimination is properly illegal and unconstitutional. And on the other hand, rules of general application need to be able to apply to all sorts of different spheres of life, religion being one of those spheres. And viruses don't stop at church house doors. And so the challenge for the legal system is to try to strike this balance. And I know that some are concerned that religious freedom could be a new obstacle to the establishment of really vital public health measures, for precisely the reason that viruses don't care what religion we happen to have. It's hard to predict. The future historians should never predict the future if they can avoid it. But certainly this is going to be one of the central places, one of the central sites for us having this fight, is that area of religious freedom.
Yeah, and most members of the American public don't even realize that this term in the Supreme Court, with Justice Barrett on it, they could be revisiting this idea of laws of general applicability and whether they apply in the religious context. So this is very real and very immediate and imminent and important and urgent. We've only got, a little bit of time left, about less than 10 minutes. So I want to talk about something that I think is perhaps the most important part of your book, and also the most important part of the COVID pandemic, which is equity and equality. You started out this interview talking about the disproportionate impact on people of color. We've always said with tuberculosis and everything else that, basically infectious disease are the social leveler. Everybody's in it together. But are they? Some of us, like at Yale, have one reality, and others, like in a poor inner city neighborhood or with a lot of essential workers and people with pre-existing conditions, have a very different reality. What does this pandemic tell us about equality and equity? What can we learn from past pandemics? And what should we be doing to prepare for a more just world going forward?
Well, it's really important questions. I think one of the things that we see in the pandemic is the inseparability of questions about health on the one hand from basic questions of economic justice on the other. I mean, it's become incredibly clear that access to healthcare is a vital part of human flourishing and human freedom. And that really challenges some of Americans' traditional conceptions of what freedom is. People in the United States have often defined freedom as keeping the government away. But it turns out that in many ways, finding ways to get access to resources like healthcare, and oftentimes through the government, is indispensable to letting us be free. And that's one of the things that this pandemic has made salient, is let us see all the more. When a vaccine is online, we're going to need to be able to distribute it. We're going to need to be able to administer it. And it's not going to matter, shouldn't matter, whether people have the ability to pay for the vaccine. In fact, we all have a stake in getting everyone a vaccine. And of course, in public health questions, we oftentimes all have a stake in making sure that people have their health looked after. So I guess the thought here so far is a hopeful one I've shared, even despite the miseries of the pandemic, is that maybe we can see a little better the glaring inequities, and maybe we'll be able to address them. We're certainly going to have to address some of them in the course of the coming weeks and months. Maybe we'll be able to do a little better.
Yeah, and of course, I always thought even before COVID that the prevailing narrative in the United States and globally, frankly, was a narrative of inequality and inequity, people being left behind. And you mentioned access to affordable healthcare, but it's also the deeper social, economic factors, of income, employment, housing, things like that have really been quite striking in causing the inequities that we've got now. And you also mentioned vaccines. Should, for example, when we roll out vaccines, apart from the cost, let's say the cost isn't the barrier, but we've got a scarcity of vaccine, which we will at the beginning, should priority be given on the basis of race?
The basis of race exclusively. I would think that priority should be given on the basis of vulnerability and essential workers and the most vulnerable.
Does that include race?
I think it would end up producing a disproportionate racial effect, right? That is to say, if we identified the communities, I just want to start with identifying the communities that have been most affected and reverse engineer the triaging rules from that.
Yeah.
Now we know, because of the statistics, that is highly likely in many areas to produce a vaccine program that would target in the good sense communities of color.
Yeah. So my last question before I get to my really final question is this. It's really, I think, significant and meaningful that, the two major social upheavals in the last year in 2020 have been COVID, but also, George Floyd's murder and the protests about racial justice in the United States. Do you see those as entirely, from an historian's point of view, but also an observer, an intellectual observer? Are these related, or are they totally separate? And if they're related, how?
Well, I referenced the protests at the very end.
You do.
I think they're connected. I mean, we in the way in which we see terrible inequities becoming more salient than at any moment in my lifetime through COVID. It's 1 in 1,000 African Americans have died because of COVID. I mean, that kind of statistic is just a stunning statistic that helps us see better some of the really terrible inequalities in American society right now. And I hope readers of the book will see that in the book, that we can see going back that time and time again, disease and our response to disease has exacerbated and highlighted those inequalities, and at the same time shown some possible ways forward that would be better paths.
Yeah, I mean, I think, we're in the middle of a presidential election, and, one of the big debating points is, whether or not the United States, still has structural racism. And how do we get beyond that structural racism? So we see, a boiling cauldron of pandemics where everybody's life is, gripped by this microscopic virus. At the same time, you've got enormous, income and social inequalities. And you also have, we're reckoning with racial justice. In an election year, have we seen this before? This kind of cauldron in the United States?
Well, one might think of the election of 1864. There's a smallpox epidemic in 1864, racing through the contraband camps, the camps of recently freed enslaved people who are behind Union detachments. So we've had these kind of conjunctures before. One slightly hopeful piece is that in our version of it, more people have voice. And so we're able to see protests and hear voices that, in a way, and certainly in 1864 we just couldn't. And so we're grappling with things now. People have been able to put issues on the agenda that they couldn't before. And I think that's a good thing. It's a hard thing for a democracy, but it's a vital, indispensable thing. We just have to do it.
One of the things is, we've seen a lot of social protests and we've seen political rallies. And a lot of discussion has been, can you carry on a political rally in an election season, or can you protest an injustice in the midst of a pandemic? Is it safe? Is it?
Oh, well, I mean, I guess you'd want to talk to a public health expert, not a historian. There is a long history of conjunctures.
Yeah.
Political controversy and epidemics. 1918, 1919 sees a huge outbreak of influenza, but also lynchings and racial pogroms, race riots. 1919 is a really dreadful year for African-American communities in the United States. And so we've seen these conjunctures before. Social unrest is connected to viruses in all sorts of complicated ways. But it both helps to produce the opportunities for viruses. I'm thinking of wars here in particular, Civil War, World War I, And then social unrest helps to, produces viruses and then generates responses. There's a wonderful historian of epidemics named Frank Snowden. And Professor Snowden's great idea is that epidemics and social structures go together. You have to study societies to understand epidemics, and epidemics to study societies. I think he's absolutely right.
Yeah, so I'm getting to my last question. I'll preface it by this, and you can kind of respond to this and the last question, which is, after the great influenza pandemic, we had something that people say, well, what happened after that? It wasn't World War I, as you know, because that was going on at the same time. But we did have the Roaring 20s. People got back, they socialized, and then we had the Great Depression. So, what is our future now? I began this interview, and thank you. You've been so eloquent, so amazing in so many ways. And I've loved it. But we began by saying, there were two paths. And you hope we choose the wise path. What is the path, what is the path we should choose? And, and does history teach us anything? Will we become a community knitted together by this or torn asunder?
Well, historians in the future are never a great mix. On the other hand, what else do we have to predict the future other than the past? There's really no choice. There are really inspiring pieces of our history. We have crucial members of the founding generation in the early U.S. Supreme Court, the greatest legal minds of the 19th century organized themselves around the idea that it was indispensable that states and local communities have the power to respond rationally and effectively to public health and infectious disease crises. This infectious disease was epidemic in early America, not new to our history. So we can be inspired, I think, by the fact that our forerunners did respond to disease and found all sorts of valuable state power to do so. On the other hand, we can do it better. We can do it better in the sense that we can learn from their mistakes and see the inequities they built into their responses. And I think there's a hopeful path ahead of us, one in which we can see the inequities that get illuminated by public health crises and address them too. So that's my hopeful thought. But this may just be more temperamental, Larry. I'm just telling you that I'm an optimist, not reflecting on the actual state of the world. There are also pretty terrible paths that could easily, dystopian paths that could easily come about. But let's hope. Let's hope for your optimistic path.
John Fabian Witt, what a wonderful interview. What a wonderful book, American Contagions. And, we're all, trying to figure this out, and just having somebody like you reflect on the past, the present, and the future. It's just been a real treat. So thank you so much.
It's a pleasure, Larry. Thanks so much.
Take care.
Bye-bye.
Thanks for listening to this week's Afterwards podcast. Subscribe, rate, and review us wherever you get your podcasts. Send us an email at podcasts@c-span.org.